Hi everyone. Hey, Nigel here from Hand Pain No More again. I'd like to share with you today quickly on what is carpal tunnel syndrome, what I think you can do about it for hand therapy, whether you should do injection or do surgery, right? So carpal tunnel syndrome is a condition where there is compression within the carpal tunnel itself. That's why the term is called carpal tunnel syndrome. So what happens that we have a tunnel in our wrist, right? And this tunnel contains 9 structures. One of the structures inside there is the median nerve. If you look on my bottom here, bottom left here, and what happens with this compression there, it compresses the median nerve and it causes nerve symptoms. So some patients they report or complain about tingling, pins and needles, numbness across the palmar side of the hand. So which includes the thumb, index finger, middle finger, and long half of the ring finger, as well as half of the palm itself. And at the back, there's some as well. You can see the image on my right as well. So it's a really common condition. And the real question is that how far advanced is the patient? Sometimes they are very mild, the condition is not there all the time. It's just maybe in a whole day of 24 hours, they experience it maybe 5-10 minutes in the whole day. For patients who are really, really advanced, really, they might feel this numbness and tingling all throughout the day. For really, really advanced, terrible condition, patients can't feel. So what they do is that when they hold on to something, it just drops out. Hold something and it drops out, and they just can't, because there's the loss of sensation. But not only that, there'll be loss of power as well. For really chronic carpal tunnel syndrome that's not managed, you will see my image this side. Oh no, this side. What happens is that the muscles start to shrink, is atrophy. So and atrophy is irreversible. So if you know someone who already has carpal tunnel syndrome for months and maybe a year, I would immediately recommend for carpal tunnel release. Really, just quickly get it done. If it's very mild, you just got it recently because you started doing some workout or you bump or fell, hit yourself, you swell up. That's fine. We can deal with the acute one. But we've been there for months and years. I would just say quickly go and see an orthopedic surgeon or hand surgeon. What they do is that if you see the image over here, there's a small little flap that keeps the tendons and the carpal and that covers the carpal tunnel, right? What happens that the orthopedic surgeon will just do a quick operation and just slice through and then lift off the pressure from the median nerve. Patients often feel relief almost immediately, especially if it's very mild stages, right? Where there's not much nerve damage. But for very long-term cases of carpal tunnel, when they after do the surgery, patients might still feel a numbness because the median nerve has been squeezed for a long time. So it takes some time for the nerves to regenerate. So it depends on what stage you are. So you can choose either do it if your condition is very mild, you can just do hand therapy. Hand therapy, what we do that we get you a splint that will lift up your wrist a little bit. This allow the median nerve to breathe and decrease the pressure on the wrist and to be worn 24/7, even while you sleep, right? You can take it off to shower. This is a very important thing, just to allow your median nerve to breathe and not to overuse it, right? We do a lot of ultrasound for you to let the soft tissues inside your wrist heal, with of course teach you some exercises and glides and stretches, which I'll show you in another video later. That's for hand therapy, and usually patients will see a result within 2 to 4 weeks. If it's really, very, very mild, like I mentioned earlier, if it's moderate or very severe, very advanced, really immediately see a hand surgeon. Just get the release done. Really, it will help you, because I'm more concerned about long-term repercussions. If it's very mild, we can sort it out for you immediately. Yeah, I mean, most of the time, 98% of the time, carpal tunnel syndrome is treatable with just with hand therapy. It's just for a small number of cases where it's too chronic, too long, then for those, they need to consider surgery. Right, so that's all about what is carpal tunnel syndrome today. So you learn what is carpal tunnel syndrome, you learn what we can do for hand therapy, and it's really advanced or really severe. I would recommend for you to do a carpal tunnel release. So that's all for me today, folks. So anything, just comment below in the comment section, and take care. See you. Bye.